You don't need to be good at math to be good at dosage calculations, and I'll prove it. In this video, I'm going to teach you the exact 6-step method I've used for years to turn med math failures into nursing students who actually do dosage calculations for fun, all in as little as a single weekend. It's a simple method that does not require memorizing lots of formulas or calculating conversions, and it even allows you to self-check your own work even on test day. Plus, you use the same 6 steps for any kind of dosage calculation problem, whether it's the most basic how many tablets sort of question to the most complex weight-based IV drip type questions. If you're ready to turn dosage calcs into guaranteed points on every exam and never have to worry about a required dosage calc test again, let's get started. If you wanted me to send you a free copy of my dosage calculations cheat sheet, just drop DC in the comments. That's a D is in dosage, C is in calculations. Put DC in the comments and I will give you the link absolutely free. It's got the most common conversion factors you need to memorize. It has a summary of the 6 steps I'm teaching today, and it even reminds you of the 2 most important rules plus the buddy system. Remember, drop DC in the comments so I know that you want it, and I will give you the link for free. Usually, when I teach dosage calculations, I start with my test anxiety strategy. So, sorry, I can't do that today because I'm focusing on dosage calculations, but I want you to know if you have a lot of math anxiety surrounding dosage calculations, which a lot of people do, don't feel bad about that. I just want you to know it is something you can deal with test anxiety strategies. And if you want me to make some videos about that, let me know. Or you can always join my Study Like a Nurse tutoring community, and I would be happy to teach it through you there or with a one-on-one tutoring session. In any case, if you hang out with me for more than 2 seconds, you're always going to know that I believe that the most important thing to start with is normal. And what is normal for dosage calculations? It's your conversions. If you do not know your conversion factors, then when you get on your test and you have to use a conversion factor, you won't be able to get the right answer because you can't plug in the conversion factor that you need when you need it. In any case, these are the most common conversion factors that I see. So if you memorize these and then you probably already have some memorized, things like 60 minutes is equal to 1 hour, then you are good to go. One thing I would like to point out, 2 things I'd like to point out. The first is the metric system. If you're like me, decimals make your brain hurt. And a lot of times in chemistry classes, when you have to learn the metric system conversions, they teach it to you in decimals. They would be more likely to say 1 gram is equal to 1,000th kilogram. And that makes my brain hurt. But guess what? It means exactly the same thing if you just say 1,000 grams is equal to 1 kilogram. And now we can work in whole numbers. To me, that's easier to memorize. I hope that's easier to memorize for you too. The other thing that I like to point out is that we need to know the metric system and the apothecary system. The apothecary system is probably what you're more familiar with in the kitchen. So it's the teaspoons, tablespoons, ounces. But we can convert that all to metric system. I like to start by just remembering that the 5 milliliters is always equal to 1 teaspoon. If you can do that, and if you can memorize, you can either stair step it and be like 5 milliliters is 1 teaspoon, 3 teaspoons is 1 tablespoon, and 2 tablespoons is 1 ounce. And then if you ever need to figure out how many ounces is in milliliters, you can just stair step it back to figure out how many milliliters it takes for an ounce. Or you can do a shortcut and just memorize it. I like to do the shortcut memorization because you do use these kind of frequently in nursing school, and it's nice just to have them on the top of your brain. That's why these have triplets instead of only twins to memorize. So let's get into the dosage calculations now that we have our conversion factors handled. First, we're going to lay the groundwork so that I can give you a couple of principles, and as long as you keep these rules, you're going to be fine with dosage calculations. The first concept I want to explain to you is called the buddy system, and this is not a trick question that I'm about to ask you. If I was going to write a fraction, and on that fraction, I put a 2 in the top, which is the numerator, and I put another 2 in the bottom, which is a denominator, what is that fraction equal to? If you said the answer is 1, you are correct. It is not a trick question. I never ask trick questions, okay? So let's go on, and I'm going to ask another not trick question. If I take the 2 that was on the bottom and I put it up to the top, and then I take the 2 that was on the top and I move it to the bottom, so I basically flip-flopped this fraction into a new fraction, what is the new fraction going to be equal to now? If you answered 1, you are correct again. This is what the buddy system means. We know mathematically if we have one number over the same number, If the number on the top and the bottom are the same, it is always equal to 1, okay? Now, this is important to dosage calculations because it means we can flip-flop numbers when they're the same, and it's not going to affect the outcome. Now, we do have rules to follow, but I want to show you why this is important because you never thought about it this way. You know those conversion factors we were just talking about? These are all the same, okay? 1 kilogram is the same thing as 2.2 pounds. Because if you have 1 kilogram of something, you have 2.2 pounds of that thing. And if you have 2.2 pounds of that thing, you have 1 kilogram of that thing. They are the same thing. They're just wearing different Halloween costumes. That's what I always say. They're twinsies in different Halloween costumes. The 1 is wearing a kilogram's Halloween costume. The 2.2 is wearing a pound's Halloween costume, but they are the same number. That means when we plug in buddies, I call these buddies now, okay? I call them lots of things. We can call them buddies. We can call them standard constants. We can call them conversion factors. But when we plug them into our dosage calculation problem, we can plug them in right side up or upside down, depending on the rules we are following, and we can still get it correct. It does not matter which direction we plug them in because they are the same. They are the same, just like 2 over 2 is the same. You can check and see if 2 numbers are buddies by asking this buddy system question. You say, if I have 1 kilogram of something, do I also have 2.2 pounds of that? If the answer is yes, great. Let's ask it in reverse. If I have 2.2 pounds of something, do I also have 1 kilogram of something? The answer is yes. Therefore, these 2 numbers are buddies. And we can say that about everything here. We can say, if I have 5 milliliters of something, do I have 1 teaspoon of it? Yes, I do. If I have 1 teaspoon of that thing, do I have 5 milliliters of it? Yes, I do. So that is going to be true of everything. I call these global buddies because they are true no matter what problem we are doing. But we also will find that we have local buddies. That means in a very specific problem, a healthcare provider is going to give us an order, and that order is going to contain 2 buddies, and we'll be able to figure it out. But those 2 buddies are only buddies for that particular dosage calculation problem. They're not going to be buddies next week when we're doing a different dosage calculation problem. Those are local buddies. So for now, file away the buddy system question so that we're going to come back to that later. And remember that buddies are the same. They only have different Halloween costumes. From now on, we don't even care about the numbers. We're only going to be looking at the units. So the liters, the pounds, the kilograms, the milligrams. When we're setting up our problem, we only care about those Halloween costumes. The numbers, they're along for the ride. They're not getting left behind, but we're looking at the Halloween costumes. That's immediately going to make your dosage calculation setup a lot easier. Are you ready to learn the 2 unbreakable rules that are going to guarantee you never get a dosage calculation question wrong again? Right now, we're just setting the groundwork. Remember these rules, they're going to come back later. When we talk about the sides, we're talking about the top side or the bottom side. So rule number 1, units you are trying to solve for are written on the same side, either top side or bottom side. That means that if you are solving for milliliters per hour, then somewhere on the top, you also have to have milliliters, and somewhere on the bottom, you also have to have hour. You can have the 2 that you're solving for, and you can have the 2 hours you're solving for. You cannot plug in any other Halloween costumes that are milliliter or hour other than those. Now, number 2, units you are trying to eliminate are written on the opposite side. If it's not milliliters or hours, we need to eliminate it. I always say we take that Halloween costume and we're putting it in the dumpster fire out back. It means if we have, say, milligrams in our problem, we don't want to solve for milligrams. So if milligrams is somewhere on top, we have to also plug it in somewhere on the bottom in order to satisfy rule 2. And every single Halloween costume, every single unit in our setup problem has to either meet rule 1 or it has to meet rule 2 before we know we are completely finished setting up the problem. I promise you, if you follow these 2 rules and you never break them, you will never get a dosage calculation wrong again. When you're practicing, you might sometimes get stuck and think, I don't know what to plug in next. But that's different than what you're doing now, which is solving the problem, thinking you got it right, and then turns out you got it completely wrong. With this, you will always know when your problem is completely set up. And if you have not completely set up, if you just kind of got stuck, you will know you're stuck so that you can go and figure out what's going on. And the more you practice, I actually have a practice plan. So if you put DC in the comments when I send you the cheat sheet that has the conversion factors and the review of the rules I just taught you, plus the 6 steps, I will also send you a video with my practice plan that explains exactly how to practice dosage calculations so that you can master this skill for life. Don't worry if this doesn't make complete sense to you yet, because it will once you see an example and you try it a few times for yourself. But the summary is, if you follow these 2 unbreakable rules, you will never get a dimensional analysis problem wrong, unless you can't read your own handwriting and you punch the numbers wrong into the calculator. I can't help you with that. Now let's go through the 6 easy steps for the dimensional analysis. Because if I haven't mentioned yet, dimensional analysis is the method I am teaching you. It's way better than every other method, and I have tried them all in my 16 years as a professional nursing tutor. This is the best one for students with math anxiety, for students who just have never really loved math. And if you have PTSD from trying to do dimensional analysis in chemistry, I got you covered, because this is specific for dosage calculations, so I break it down in a way that's different than you did in chemistry. Step number 1, I really need to rename this because I want to call it gather your assessment data, because you are a future nurse, okay? And that is always the first thing a nurse does, is get your assessment data. Now, when we do assessment data, we are going to get 3 pieces of information from the problem. So we're going to read the dosage calculation problem, and we're looking for 3 pieces of information. We're looking for, what buddy are we solving for? So if it's an IV calculation, we might be looking for the IV flow rate, milliliters per hour. We are most concerned with the units. The numbers come along for the ride, but we're looking at the units. So we want to know, what are we solving for? We want to know, what is the order? And we're always finding buddies. So every number that every number that we plug in has to have a buddy. And we can check with the buddy system question. If we have this, do we have that? If we have that, do we have this? So we want what we're solving for buddy, we want the order buddy, and we want the what's available buddy. Now, if you are familiar with the formula method, that should be easy for you. You are used to finding out what's available or what's on hand and what the order is. Only now it's a little more flexible, because sometimes there can be more than one thing that's available, especially for the really complicated problems, but you don't have to worry about it. Step 1, gathering assessment data in this method is designed to prevent you from feeling overwhelmed or not knowing what information to choose in the problem. Because sometimes you're going to need more than one piece of information, and you might not know, do I need this information in the problem or do I not? That's probably a problem right now if you're using the formula method. It will no longer be a problem because you can figure it out later, okay? Later on in this process, you're going to be getting clues that are going to help you figure out for sure whether you need to use information or not. Right now, we just need 3 things for sure. What we're solving for is easy, because every problem should tell you that. What the order should be usually easy, because it usually says the healthcare provider orders. And what's available or on hand, there should be able to be at least one thing that's obvious to you that okay, I feel pretty sure I'm going to be using this information. And we plug that buddy in and we worry about the rest later. Step 2 is everybody's favorite step, because it is the easiest and the fastest. It is just setting up the format. So if you've ever seen dimensional analysis problems, you usually put the units you're solving for on one side and then an equal sign, and then just a crosshatch. If we're doing milliliters per hour, equal sign, there you go. That would be what your setup looks like, except with better handwriting. Step 3 is why I bought this hat. I've been wanting to buy it for years, y'all. Because I always tell my tutoring students, step 3 is where we put on our Sherlock Holmes hat. I even got a magnifying glass and a fake pipe. My kids are fighting over this. I have 6 kids, if you didn't know. Just 6 easy steps. In any case, step 3 is where we put on our Sherlock Holmes hat and we start following the clues. We start with our assessment data from step 1 and we plug in buddies using the 2 rules. So this is where those 2 rules and the buddy system foundation that we set come into play. We're going to take our buddies, preferably from step 1, and we're going to say, how am I going to plug those buddies in so that I can satisfy rule 1, which is things we're solving for, the Halloween costumes we're solving for go on the same side, top or bottom. Because remember, we already plugged in what we're solving for. And anything that we're eliminating goes on the opposite side, either top or bottom. The assessment data is the easiest stuff to plug in, but we always plug stuff in the laziest way possible. Never guess when you are plugging in. Always make sure you can tie it directly back to one of the 2 rules. And you are not done plugging things in until every unit, every Halloween costume is accounted for. You have either solved for it or you've eliminated it. Dumpster fire out back. Now, if you run out of assessment data, or if none of the assessment data is obvious how to plug it in, like maybe it has different units than what you're solving for, then we move on to step 4. And I always say going back and forth between step 3 and 4 is kind of like baking a cake. Like, when you make the batter to a cake and it's all liquidy and you pour it in the pan, but it's kind of uneven, and you just take the pan and you kind of shake it a little bit to even it out. That's what we're doing with step 3 and 4. We're evening out our dosage calculation setup. So sometimes we have to flip-flop back and forth between step 3 and 4 in order to follow the 2 rules. But if we don't know what to plug in step 3 from our assessment data, then we can skip ahead. We can push pause on step 3, follow the clues because we have our Sherlock Holmes hat on, and go to step 4, where we either plug in or create constants. Now, this can look like going to our global constants, remember the conversion factors that you memorized, or it can mean going back to the problem and seeing if we need additional information. But now, if you do have to go back to the problem, it's easier. You don't feel overwhelmed because now you have clues. You can look at the setup you have so far and you say, I need something with milliliters. Is there anything with milliliters in the problem that I can create a buddy out of? Or you think globally, I need something with hours. Is there anything with hours that I can create a buddy out of? And of course, there's 60 minutes equals 1 hour. That could be a global conversion factor. Or maybe there was an order in the problem that says that the IV solution has to be given over the course of 8 hours. That could be something we use to create a local buddy. So it really depends. We just follow the clues. This is something that's easier to understand once you've seen an example. So again, don't worry if this doesn't make complete sense to you now. You have to do an example for yourself to see how it is in action. The one thing I want you to remember is you are not on your own to figure this out. It is a system of self-checks. All you have to do is follow those 2 rules, and you will always have a clue for what it is you are looking for. You will never be guessing again. It's like training wheels for your bike. Once you have completely satisfied rule 1 and rule 2, that means all the units in the problem are either solved for by being on the same side, top or bottom, or anything that's not solved for is being eliminated, dumpster fire out back, by being on the opposite side, top or bottom. Now we are finished step 3 or 4. We can take off our Sherlock Holmes hat, sadly, and move on to step 5. Step 5 is where we finally get to the math. And then all you have to do now is any unit that you've eliminated, it is in the dumpster fire out back. We don't care about it anymore. We only care about the units we're solving for. But the numbers remain. So now we have a bunch of naked numbers because they've lost all their Halloween costumes. And we're going to take those naked numbers. We're going to multiply across the top. We're going to multiply across the bottom, put them in that new Halloween costume that we're solving for, and then we're going to divide those 2 numbers. That's all the math you have to do to be successful at dosage calculations. Once you've done that math, then you just follow the rounding rules for your school. Usually, that means that the problem should tell you where they want you to round to. So if they say round to the nearest tenths place, you would look at the tenths place in your answer, look 1 spot to the right of that, and if it's 5 or higher, you're going to take the tenths place, bump it up a number, slice off the rest, and call it a day. But if the number to the right of the tenths place is less than 5, we're just going to chop that off, leave the tenths place alone, and call it a day. That's the standard rounding rules. Double check with your school to make sure that that's the rules they follow, but you should be good to go if you just understand that. Remember that learning any new skill requires practice. If you're ready to see me put this dosage calculation method into action with a real dosage calculation problem, head on over to the next video and I will meet you there.